either introduce or let, you've got the list there, and I've instructed our guests to try to keep it short and sweet, so maybe
Sure.
2-minute presentation.
Sure, if you just come forward and state your name and address for the record.
Yeah, my name is Jeff Segal. My address is 3300 Battleground Avenue, Greensboro, North Carolina, and I'm a neurosurgeon. And I thank the committee for its leadership in vetting this very bold proposal to tackle 3 challenges: the multi-billion-dollar cost imposed by defensive medicine, the inefficient process to compensate those harmed by medical treatment, and patient safety. I just want to focus on defensive medicine. It's the ordering of tests and procedures with the sole goal of keeping doctors from being sued, and it costs Georgians billions of dollars every year. If you're a doctor, you will likely be sued. I was sued. Many of my colleagues have been sued, and will change your behavior just to prevent being sued again. The New England Journal of Medicine reported the average doctor had a 7% likelihood of being sued each and every year. What about specialists? Well, for neurosurgery, my specialty, it's 19% a year. Cardiovascular surgery, 19% a year. By age 65, 99% of physicians in high-risk specialties have been sued, and nobody is spared. And the thing that makes this quite interesting is that for patients, only 20% of those claims even yield any payment for the patient. So one of the questions we're asked is, why do doctors treat medical malpractice differently from being in an auto accident, for example? Shouldn't we just turn it over to our carriers and be done with it? And the challenge is that the two systems have little in common. A med mal lawsuit is packaged as an assault on your reputation. There's blame and there's shame. Your future will be tied to a theatrical battle of experts lasting 4 to 5 years, and the outcome might cost more than your medical malpractice policy limits, putting your entire life savings at risk. You'll spend time preparing for and in depositions, time you could be taking care of patients. You're told not to talk about the case. It's stressful to hold matters such as this inside. You'll have to explain your record each and every time you apply for privileges and licensing. So amidst this backdrop, doctors will do whatever it takes to avoid being sued again. This means ordering every test under the sun. I know it, I've done it, my colleagues do it. This is why we get defensive medicine, the practice of medicine to keep a doctor from being sued, and very expensive. Let me close with an illustration and then describe what's possible. In the US, a patient with a minor concussion goes to the ER. That concussion might be associated with brief loss of consciousness, nausea, headache, etc. The patient is typically neurologically intact, in other words, normal. But in the US, almost all of these patients will get a CAT scan of the brain just to be sure there's no blood clot. And CAT scans are not cheap. Our challenge is how to limit CAT scans only to those who need them. Well, here's actually a piece of good news. One study identified 5 high-risk factors predicting problems after minor head injury. So if a patient's in a car accident, for example, he should be scanned. If a patient's older than 65, he should be scanned. And this has been studied, and using these criteria, this allows fewer patients to be scanned, but not at the expense of missing a blood clot in the brain. And when the study was performed, these 5 high-risk factors were 100% sensitive, but only required a third of patients to actually be scanned. So no one was missed, but you didn't have to scan every patient. So no patient who would have been triaged away from the scanner had a problem with a blood clot. Resources would be saved without causing harm. So where was this brilliant study performed? Well, it was performed in Canada. And so one of the questions, could we actually use this data in the United States? And theoretically, the answer is, of course, there's nothing preventing us from using this. But I would argue from a practical standpoint, not really with our current medical legal system. So the proposal before you is bold and innovative, and the collective cost will not be 1 penny more than what we are spending today. So let me repeat that. The proposal, the collective cost of the proposal will not be a penny more than what we are spending today, but the potential savings are absolutely enormous. Patients and doctors would benefit from a better system, a no blame, no shame patient compensation system. Thank you.
Thank you. Are there questions for Dr. Segal? No questions. Is Dr.